Hi again, friends. Welcome back to another intentional and mindful conversation at What's on Your Plate podcast. If you're new here, welcome. I'm Sarah, your host. This is a space to talk about the many things that are abundant and also heavy on our plates of life. This platform brings you discussions that give a different and transformative way of thinking about the topics my guests share, and often reshape the way you do life. At the very least, new perspective is gained so that we may show up in the world with more compassion, more intentionality, more humanity. If you haven't done so already, I'd love for you to click the follow or subscribe button wherever you're listening to this podcast from. Doing so keeps conversations like today's coming. Of all the clicks you'll make today, I really would appreciate so much if that was one of them. When we talk about aging, most of the time it isn't viewed with a broad lens. Most of us expect to grow old, and if we are fortunate, we do. Have you given a deep level of thought about what will happen when you get there, though? This episode is really unpacking a lot of multifaceted issues surrounding aging and what our current culture, political climate, and what I'll refer to as the invasion of AI has to do with it all. Listen in. Your future self, those that you may be caregiving for now, and even your kids, will thank you for it. I'm honored to give a big welcome to Dr. Jacob Kendall. Here we go. So I want to introduce my guest today, a former college professor and founder of Versatile Social Worker. Jacob Kendall is here today talking about one of his many interdisciplinary focuses, the aging population, and what the reality and outlook is for the current aging population, that of which ultimately includes everyone, including us, and all of those fortunate enough to grow old. So thank you, Jacob, for being here today.
Yeah, thank you for the opportunity to have a good conversation, Sarah. Appreciate that. I did found this versatile social worker. It's now the versatile professional, but more relevant for our conversation is the smart patient. I know you'll ask me at the end, how can people reach me? So I'll mention that again, but I just want to make sure to plug that up front as well.
Oh, absolutely. Thank you for just clarifying that. But we'll absolutely, for those listening, every way to connect with Jacob will for sure be in the show notes, and we'll be in conversation along the way here with just the different types of work that you do and how you're of service. So, but yeah, let's get to know you a little bit. Let's hear about just why this is something that is passionate for you to be working on every day.
Yeah, it comes from both directions, personal and professional. On the personal side, I've had two open heart surgeries and a lot of heart disease, specifically heart valve disease, has run rampant in my mom's side of the family. Several of us have had to deal with it. I'm not the only one who's had multiple surgeries, and we're over accustomed to hospitals and funerals and all the things that come with heart disease, and having complex medical needs myself, and kind of stumbling through figuring out how to navigate our ridiculously complex, asinine, should I say, healthcare system. I learned things along the way, and I don't want my heart surgeries to just benefit me. And then from the professional side, I have broadly interdisciplinary training. I much prefer to be a jack of all trades rather than an expert of one. So I've learned about aging from a variety of perspectives, everything from molecular, cellular biology, all the way up to global population trends. I'm much more comfortable on the macro side of things, which I'm sure will come out throughout this conversation. I have a social work degree, for example, but I never wanted to be a therapist. For social workers out there, I usually say I'm so macro, there should be a level above macro. I really nerd out over examining population level trends when it comes to chronic disease, aging, immigration, things like that, and more especially how all of those are related to one another. So the personal and professional come together at an intersection of wanting to health advocacy, I'm not an older adult myself. I'm 39, but most people who have heart valve disease and have had surgeries have it in older age. So that gives me a little bit of way of relating to many older adults who are dealing with chronic diseases.
Thank you for sharing all of that. That really kind of puts into perspective just um, why you're doing the work that you are and why it's so important to talk about for sure. The interdisciplinary part of it, I think, is really interesting and just all the different angles you're looking at everything and the work that you do, why it's all so relevant to each other. And it's like a holistic way of looking at all of the moving parts of what you're talking about here. Of course, holistic in this context, meaning just all parts, always, all connections, versus just looking at one area because they all are intertwined. And I think that that's often missed a lot of times, and you're bringing light to that. Need to just acknowledge and work with the ways that everything just is part of the same puzzle.
Yeah, for sure. You look at people who are focused on aging, just to use one example, and most of them focus really deeply on one thing, like ageism or senior living or hospice or diabetes or genetics or whatever. And that's great. We got to have experts. I mean, I've had two valve surgeries, and I'm glad that the people who operated on me are really, really, really specialized in valve surgeries in particular. So we need those specialists, but I think we also need to have interdisciplinary folks who can facilitate the dialogue across these different areas. Being a former professor, I can say that the different disciplines are highly siloed. Being a patient, the different specialties are highly siloed. Even in business, they're always telling us to, hey, you got to choose one audience, one problem, one solution. I'm like, I want my solution to be to help people think more interdisciplinarily. So yeah, I that's just where I come in. Is we need the experts, but we also need some people who are able to facilitate those dialogues across it, and that's the value I try to sell.
Absolutely. Especially as it pertains to the aging population. You and I had a previous conversation, gearing up for this one today, that really shed a lot of light on why there's so many problems within the aging population, in terms of accessibility to healthcare and caregiving, and why many different parts of the population have better access to it than others, and just all the moving parts associated with our forward progression in this earthly existence. Did you want to talk a little bit about the many moving parts of that?
Yeah, you know, I can give a few different examples to kind of highlight this issue. Let's in no particular order. One example is when I was in my PhD program, and I completed that nearly 10 years ago. Wow, that's crazy. The, it probably hasn't changed much, but of the thousands of places where you can do a medical residency, after you complete med school, you want to specialize in something, you got to go to a residency in it. There were 11 programs in the country that focus on geriatric medicine. That is that's not great. I think a
Mm.
lot of physicians and nurses and healthcare providers don't know the specific challenges that older adults have. Oh, your knee is hurting. Well, that just comes with age. Or you're feeling depressed or lonely. Well, that just comes with age. Like, no, let's back up a little bit. This is not just age. This is not just some deterministic fate that people have to resort to. Like, let's really unpack this because it doesn't have to be that way. I think also the fact that, use another example, the fact that we live in a society here in the U.S. that is obsessed with individualism. It's gone way too far. American individualism has we assume that everything comes down to individual level decision making, but we can't possibly understand what it means to age in this country without or anywhere without zooming out and looking at these more systemic issues, right? It's not just that people who are obese choose to eat too much. it's that many people who are like diabetes, stroke, and obesity and heart disease are higher in areas that we call food deserts, where the only food that people in food deserts have access to are at convenience stores that are high in sodium, high cholesterol, not, that lead to all these things. And there's no amount of individual decision making that they can do that's going to change that. And that shows us that if if we really want to move forward in a good way with the rapidly aging population that we have, I forget sometime in the next 6 to 7 years, I don't I'm not going to do the math in my mind that all baby boomers will be over 65. Um, and so that's the point that we're getting to. We have to address this from a policy perspective and from a more macro perspective, right? We're not going to be able to uh, just rely on, oh, well, families will take care of older adults or volunteers or churches or whatever. That's not enough, right? We're, and I know some people right now that are working at the national policy level to try to require employers to provide, how we have health care, maybe you have paid maternity leave if you're lucky, or parental leave. Also provide for the fact that some people are caregivers. Maybe they need to be working from home sometimes. Maybe they need some time off. So these are just some of the things that people are actually legitimately working on. We have to think about it at that level. And I know one thing you and I talked about also was immigration. And immigrants are one of the main, and it's growing, one of the main providers, especially immigrant women, especially from Latin American countries, for in-home caregiving services for older adults who are aging in their home. And now we're talking about all these things going on at the national level, talking about immigration. What I want to ask people is if you're really, really anti-immigration, then you need to tell me right now who is going to provide for our older adults? Who's going to do it? And so aging is multifaceted. It is pervasive across any industry. I love the game 6 Degrees of Kevin Bacon. I like to play 6 Degrees of Aging. You can give me any topic and I can tie it to aging in some kind of way. That's the world that we live in right now. So I could go on and on and on. You really got me fired up by asking questions like that. Those are just a few of many examples that show
Yeah.
the multifaceted, multi-level issue that aging is.
That was just an amazing share. Everything that you just poured out in the last couple minutes there, and I think a lot of what you said also ties to the idea that we don't necessarily look at what are the impending problems as actual problems until they're affecting us personally or someone we love. So for people that are, the younger generations and maybe their parents are not reaching what is the quote unquote geriatric stage of life yet, we separate that from something that we need to concern ourselves with, most of us. Like if it's not affecting us directly, then why worry about it? But that's part of the problem.
Absolutely. We're terrible at planning for crises until they actually hit. My last grandparent, my papa, my dad's dad, died last October at 96. And he did not have the kinds of retirement plans that we needed. I remember him telling me one time, he's like, I didn't make all these plans because I didn't expect to live this long, which was reasonable given when he was born. But of course, life expectancy only increases as we move forward. So, I want to believe that we're the younger of us are learning these lessons, that we're seeing our parents and grandparents. They didn't prepare for all these issues, but part of it is because they didn't expect to live this long, right? Hopefully millennials and younger are seeing like, oh, hey, we really need to do a better job at planning and making these kinds of plans, and we'll do that. I don't know because the tendency to the deeply embedded avoidance that we have of our own mortality it runs really deep. So we're working against a lot when we're talking about making better plans for the future. I don't know which way it's going to go. Some days I have optimism because of what I just said, but some days I have pessimism because we avoid death like the plague. And I think we should embrace our mortality more. But you're right. You're pointing to a really important issue. We're not good at planning in advance.
Well, and I feel like as well, at least how I have experienced this situation, you don't necessarily have to be in your 90s to be facing, your demise. My mom passed away at 66 from cancer. And while that's obviously not something that she anticipated, didn't plan. Most people don't plan to have to, you know, sort out their affairs at such a young age. But the point why I bring that up is because unless you have some type of tragic, sudden loss, we all need to plan for needing care, whether it's because of an early onset of disease, whether it's because there's some type of debilitating accident that causes you to maybe not be able to care for yourself, even though you're still young, or you're fortunate enough to grow old. It's something that we all should be thinking about more because nobody has a crystal ball, unfortunately. Um, so I feel like, again, that idea that we think that, we have all this time and we don't.
Yeah. I think there's another reason too. I agree with everything you just said, but I firmly believe that the more that we embrace our own mortality, it might seem counterintuitive. And of course, this is just an in general kind of thing. I actually think that the more that we improve the quantity and quality of our life, there's a socio-emotional benefit to being more willing to talk about death, dying and death, including our own eventually. It's not
Mhm.
just the practical aspects, which you were just talking about, and I agree with, but there's the socio-emotional aspect of it as well. I think that there are these intangible benefits of being willing to have those conversations.
100%. I couldn't agree more with that. And um, being more willing to face those conversations, I think, is part of the solution moving forward in our world. What is your thought on how that can become commonplace?
Well, like I said, I hope that we're kind of learning from this. Some practical things that I want to see are as soon as you get married, or if you don't get married, as soon as you graduate college, or if you don't go to college, just we don't have an official rite of passage into adulthood here. But when you become an adult, uh, you know, I'm early to mid 20s, no later than early 30s, start having conversations with whomever it matters in your life about, hey, I need a life insurance policy that has disability protection, all those other things. I need maybe I should write down my ideal death plans. If you don't want to be embalmed, which I definitely don't want to be, I've read about that process. Once you see something, you can't unsee it. Do you want to be cremated? Do you want to have a natural burial? What are your wishes for that kind of thing? Um, put some money aside to pay for that as well. Most of my family members already took care of that, where their adult children did not have to whenever they died. Um, and your will and your power of attorney and all these other things. What if you go into a coma and, be thinking about those things? I think that should be a decision that people make upon marriage or upon reaching adulthood or whatever, certainly upon having children. I think that there is a way we can normalize those conversations. Um, we're seeing a little bit of an increase. I'll speak from the perspective of social work. I love seeing any kind of field spread its fingers into other industries. And there is such a thing as financial social work, which is basically combining financial planning with the ethical and empathic aspects of social work. I think people need to have basic college courses on, hey, how do you do your taxes? Um, what are the things you should look for in your healthcare providers? And another one should be dying and death and caregiving planning. So I think that we are realizing that. I don't know that that kind of thing should be addressed at the policy level. That's probably more educational. You know, let's educate churches and career centers and marriage and family therapists on providing a little bit more guidance on those kinds of things.
Absolutely. And what you're sharing brings to mind something that we talked about earlier in a different conversation about affluence as it pertains to caregiving as well. When you're talking about planning for and anticipating uh, the inevitable, some of us are more equipped to handle that earlier than others. Grandparents I have lost, a parent whom I have lost, I was in a very fortunate place, and so were they, to be able to have that planning, for one thing, happen, as well as being cared for in a way that was either personal or as professional and compassionate as possible. But not everybody has that reality. The very disproportionate way that our country kind of compartmentalizes people, um, and how that affects the access they have to end of life care.
Yeah, absolutely. The socioeconomic gaps are really bad and they affect every aspect of life, including how we age. Loneliness and isolation are a major issue in older age, and that tends to happen more with like there is that socioeconomic divide. So an example is that the part of the country where a greater percentage of older adults live in nursing homes is the Midwest. And we know that there's been a lot of outmigration from the Midwest over the past few decades. And so nursing homes are usually the option for people on the poorer end. Either that or just living in their own home without any help. Whereas hiring someone to come in and care for you in your own home is at the upper end of wealth because that's the most expensive. And so older adults, their adult children move to another part of the country, but they're staying behind, and that's one of the reasons we see higher percentage of older adults in Midwest and nursing homes. And so, I think we do probably need some policy solutions to, I mean, everyone knows no one wants to go into a nursing home, and everyone's seen an example of a nursing home. We're like, oh my gosh, that's not a great situation. And there are
Mhm.
several reasons to that. I try not to blame the workers in a nursing home because they're overworked, underpaid, burnt out, in some cases not properly trained. It's a systemic level thing. But you're absolutely right. I need to look more into it. And I only know about it recently because my brother told me they have a child with DMD, Duchenne muscular dystrophy, which is one of the worst kinds of muscular dystrophy. And I want to say it's through Medi Medicare, where they pay if a parent has to stay home and care for a child with disability, they get support, caregiver support. It's like a small paycheck for that. I
Mhm.
think we're going to need more things like that. And there are people who are fighting for that at either the state or the national level. Um, so we see some of that happening, but I mean, I don't know how we're going to address these massive socioeconomic gaps without having those large, you know, policy directed solutions. We are a welfare hating country. We just we tend to think capitalism is going to solve everything. Traditionally, Social Security, Medicare, and Medicaid have been a an exception to that rule, but we all know that a lot of that is under threat right now too. So, um, yeah, I don't know that I'm the best person to uh, think of a very concrete, practical solution to the problem you're highlighting, but I can certainly give you all kinds of examples that affirm that yeah, this is a real challenge.
Right. Well, and I think you did offer a solution by way of just talking about the need for education on the topic, college level or thereabouts, to help us just highlight this very real human need that each and every one of us are probably going to face. And I think it's important too, just to bring not just awareness, but compassion into that as well, because the way that I approached, and aging grandparents in my younger years in terms of like what I thought, should happen, or how the care should go, or what was provided was very different from how I saw that in terms of caring for my mom. There was a very big gap of knowledge there to know what was right, especially from a compassion level in terms of addressing that loneliness and that solitude and the way somebody is probably feeling or internalizing the knowing of their demise that is fast approaching. People that know that they are nearing the end of their life, um, I don't pretend to know what that feels like, but to have some type of formal training or education or some type of just way that that is communicated to us at an earlier age of how to help or even just sit with somebody or just show a level of compassion that you may not realize is needed until you are just older yourself and have a more life experience of just what somebody is potentially going through. I think that in and of itself, that is an amazing just solution to part of the problem is let's just talk about it earlier and have some more education on it.
Yep. Yeah, for sure. And not only should the educational piece is there, but people who are providing the services should be better compensated. The bottom
Oh yeah.
line, it's something I tell social workers all the time, because I have thousands of social workers in my network, especially on LinkedIn, is the reason that social workers aren't paid more is because the clients that you serve are not valued by society, and that includes older adults at the end of life. That unfortunately, that I mean that's I don't like that reality, but you bring to mind for me when you mentioned this last thing is different kinds of intergenerational exchanges that we're having, and there's some pretty innovative approaches out there. I would love to see them become non-local. I don't remember the name of the university. I need to look it up. Of course, this started in Europe before it got here, like things usually go. But there are a few universities in the U.S. that are doing this, where there's a university and a retirement community or a nursing home nearby, and the nursing home has housing for college students that they give them for free if those college students have to spend a minimum of 30 hours with residents in that community a month. That's awesome. That's fantastic
Mhm.
because intergenerational exchanges, I think, are a huge part of the solution moving forward. There's another example where older adults in the US do video calls with, I think it's extended to other countries, but when I learned about this, it was Brazil to young adults and college students in Brazil. They get to learn better English, and the older adults reduce their loneliness by having conversations. These are really cool solutions. Let's do that on a much wider scale. So intergenerational exchanges, I think, are going to be big time. And think about it, when younger people are having conversations with older adults who are, of course, near their own demise, I think that gives the opportunity for the younger people to gain some wisdom and to like you and I talked about earlier, to reap the benefits of embracing our own mortality more. In the same way that I would encourage people to interact with people of a different racial background, different sexual and gender identities, it's the same thing with older adults. I always told my students, try to have at least one non-family close relationship with someone who is at least two generations older than you. I think we should all aspire to that. Now, I want to mention one thing that might throw a wrench in all of it, because it's throwing a wrench in everything, is AI. And there are people applying AI solutions to address these very issues with loneliness or care or medication compliance and all kinds of other things with older adults. And um, I'll go ahead and I don't want to say too much in one sitting, because I know it's a back and forth, but I think on one extreme end of the AI revolution when it comes to older adults is Japan, who is fiercely monocultural. There are very few immigrants in there, and they have very low fertility, one of the oldest populations. So they are literally facing an aging crisis right now. Like, who is going to provide for our older adults? It can't be our grandchildren because we don't have any. It can't be immigrants because we don't have any. So they have AI powered robots to provide caregiving to older adults. We're not to that point yet in the US, but is it going to get to that point? So AI throws a wrench in all of this, and I don't know if it's going to be for the better or for the worse.
Gosh, there's so much to just like say about everything you just shared there. And I for sure want to circle back to that AI part of it. But before I lose my thought about something you said earlier,
I
um,
shouldn't have brought that into the conversation
oh
yet.
no, it's okay. It's also like relevant and just again multi-layered and needs to all be said. But I just really want to touch on the part you were saying about having connections with older generations, especially outside of your family circle. This is one of the most important ways that our past doesn't die, right? In terms of like history and what has happened in the world. Because yes, there are people that write books about things or somehow gets their experiences or thoughts out before they pass away. But so much of what is the human experience is just by speaking to each other and sharing the word person to person. That's how our knowledge moves forward in the world. So to be able to
Yep.
hear somebody's story and listen about their experiences and just learn from each other on that
Yep.
level, I think is so important. So that too, is part of the solution
Absolutely.
of what needs to happen moving forward.
Again, I don't have, I need to do a better job of looking up before I have these conversations about the specific examples. But there are some towns around the US where they have projects, and their project is to interview older adults before they die about the history of that town so that they can have it and document it. Otherwise,
Mhm.
it disappears. So,
Right.
absolutely, there are actual programs to do that kind of thing. That's another thing that should be more widespread. Okay, I'm sorry. Go ahead.
No, you're right though, because I mean, not everybody is an author that wants to sit down and write a book or record themselves and put it on a blog or have it in a podcast. So, and I think more people are not than are. So we're missing a lot of pieces of what has happened. Um, but everything you said about AI too, it's terrifying, honestly. I feel like is the word that comes to mind for me, as well as that way of, I don't even know if I would use the phrase providing care, because to me it seems like it's not care when it's delivered by a robot. Um, it's just really scary to think about that could be the future of the world and how problematic that is in terms of, again, the compassion of just being a human with another human.
No. Yeah, whenever I did one just about an hour ago on both LinkedIn and Facebook, and whenever I do a post on AI, I always say at the bottom, note, I don't like this reality. I would if I could snap my fingers and get rid of AI permanently and completely, I would do it because I agree with you. It's terrifying. But on the other hand, I'm learning to use AI. I'm constantly using it because I don't want to be irrelevant. And so
Right.
we are well past the point of return at where we passed the point of no return. And I think it is imperative that we need to find ways to use it in as healthy a way as possible. First of all, I completely believe that we'll be taken over by it if we don't do that. But more to the more immediate point, like this is already happening. People are already using AI to reduce their loneliness or even to seek therapy. We're not going to stop that from happening. So what can we do to make sure that it's going to be more helpful than it is harmful? And I don't know the numbers, but I'm sure that older adults are using it to reduce loneliness because other people do, right? So it's so hard to know that the AI game is changing every single day, and we cannot keep up with it. So I don't know if we haven't yet passed the point where it's possible for us to have a long-term healthy relationship with AI, that point is coming soon. I don't think that I'm being extreme in saying that. I've read a lot. I've talked to a lot of AI experts. So I agree with you, and it's going to come up with when it comes to compassion. There are going to be ethical concerns about this. AI is going to be involved in court cases. We're going to have questions. On the one hand, I would love to have a national health registry where doctors all across the country can easily access your health records for when you're traveling or for when you move or whatever. But that also has terrifying implications because it reduces confidentiality and privacy.
Mhm.
So and AI just again it exacerbates all of those issues. I know if anyone tells you that they think that they have a solution to this problem, they're wrong because we cannot possibly predict what's going to happen. It changes daily. I don't even know. I'm terrified too.
Right. Right. And anybody who is paying attention is terrified. Um, and there are some positives to it, like you said, but allowing it to just take over the human experience, I think, is one of the ways it's crossing the line. And certainly as it pertains to caring for the aging population. And as we as a country, as the current, I know this isn't meant to be a political conversation, but as the political climate continues to be challenging in this country and we continue to remove the people who are doing things like providing care, like immigrants. Um, there's a whole rabbit trail I could go down with that. But when you start to do that, when you start to take away the solutions that have been working in certain areas, like healthcare, like caregiving, they need to be replaced with something. And that might look like AI robots in the future if we continue down the path of where the country's at right now.
Yeah, we're not going to have a choice. That's where we're getting to. I can understand when you say you don't want to get political about things, but it's really difficult not to when we're talking about these
Hmm.
issues.
Hmm.
I get mad when people say don't post about politics on LinkedIn, and I'm like, well, then we shouldn't post about anything.
Hmm. Right.
Um,
Well, it's not that
so
there's a lack of desire or willingness to talk about the politics. It's just like we'll need a 10-part series, to be able
yeah,
to cover it
yeah.
all. Um, but yeah, it's problematic and everything is absolutely connected to politics in some way or another, just like everything is somehow connected to aging.
Yeah. And I could go on a long rant about healthcare as well. I know a huge campaign of recent Republican can or presidential candidates was removing a lot of ACA, including protections for people with pre-existing conditions. And I have been denied back before Obamacare. I was denied health insurance because of, but that was even before I had a surgery. It was just the possibility of one day having surgery.
Yeah.
And when someone tells me that I don't want to go to socialized medicine because I'll lose my ability to choose a doctor. I have two internal responses, sometimes external. First of all, there's no way you have complex medical needs, and you're saying that. There's just no way. Anyone I know
Hmm.
with complex medical needs sees the problems with our healthcare system much more intimately than people who don't, right? Um, and the other thing that I think and sometimes say is the whole thing about us having provider choice is much more illusory than we think that it is. We like to believe we have that autonomy, but it just health insurance companies rule the country, rule our healthcare, and then we don't really have that much choice. So, you know, going back to the point of these are socio-political, demographic, cultural, epidemiological, and economic issues all rolled up into one. And if we try to parse it out and say, well, I don't want to discuss it from this perspective, then I'm like, okay, then we're not going to have the full solution.
Well, when you say it like that, Jacob, it's really easy to understand why you have become so passionate about becoming interdisciplinary because it is all absolutely connected. And when we have a
Yep.
conversation out loud about this, I think it's easy to see why it's necessary to have many angles of knowledge pertaining to this.
Yeah.
Um,
It's the only way.
Right. Let's talk about the macro side of the social work and what that
Yeah.
looks like for you and from your perspective.
Well, you know, social work started out macro. I think we've kind of lost touch with that. You go through an MSW program these days, and it's just very, very clear that having your own private practice as a therapist is kind of considered the pinnacle of the profession. And I disagree with that. I don't think that our curriculum, our curriculum or the code of ethics is. Um, it's not very easy to tell that our profession even has a macro side if you were to read through all of that. That's my opinion. Um, and I think it boils down to probably two basic points. One is that um, back to the American individualism, we are just so accustomed to seeing everything from an individual perspective. And again, it's gone too far. I think we end up losing some of our individual liberty when we emphasize individual liberty too much. It seems counterintuitive, but I think that's what's happening right now. And the other thing is, especially in healthcare settings, social work is simultaneously trying to, one, challenge the medical model, which it claims to do, and two, at the same time, on the other side of the coin, trying to establish its own place within the medical model. I get comments all the time like, well, I'm on a care team in the hospital, and the physicians and the pharmacists and the nurses and the physical therapists don't value my input, and so we emphasize licensure and things like that. So we're at one and the same time trying to challenge the medical model while trying to establish our expertise within it, and it's a really uncomfortable play. There's a lot of tension there with that, and I think sometimes the social work profession as a whole refuses to acknowledge that that tension exists. I don't have a problem with the fact that tension exists, but if you ignore it, then it's just going to keep roiling and roiling. Um, so, from the macro standpoint, when you hear things like therapists say, well, the insurance reimbursements rates really, really suck. Yeah, the only way you're going to address that is from the very top, right? The only way you're going to is from the very top. And I think that we need more social workers in more settings. Can you imagine if corporate leaders had social workers working alongside them, or if the social workers were the corporate leaders? Good Lord, that level of empathy and ethics would be awesome. What if more social workers were politicians? I think we have a very different country right now. We had some social workers kind of at the top of the pyramid in our government. Fill in the blanks. I think social workers belong at every single table. I'm talking about a pipe dream because it's not going to happen. Uh, but sometimes it can be useful to talk about the pipe dreams. And so I think we can only really see that fully if we think about it from a macro perspective. We need to zoom out and be comfortable with looking at what these issues are like from a larger perspective. And I'm not saying every social worker should be macro. I think that the profession itself should have more focus on macro. Let the therapist be the therapist. Let them focus on the individual issues while realizing that that's not the only level at which the action is happening. Does that kind of answer your question?
It definitely makes sense. And I think most people look at the term social worker and have a very limited view on what that means and where those presence are at. You know, you think of social worker as being somebody that is helping maybe an underprivileged child, or somebody that is in a situation of not being able to advocate for themselves within the healthcare system, or somebody with a disability or something like that. But if you broaden that view to look at social work from the standpoint of, like you said, being able to have a seat at most any table, so that the social worker is the one advocating for the people and caring for the people, and is independent of the rest of the people at the table, because the one they're advocating for and being in support of the larger issues or the bigger group, I think absolutely is needed in many other areas where we don't necessarily associate social workers with.
Yeah, that speaks to the versatile social worker, which is now the versatile professional. And the main reason I changed it from that to from one to the other is because I also wanted to provide services to transitioning ministers who want to pivot their career. I'm almost done with the seminary program, and I have a public health degree as well. And with all the federal layoffs, I wanted to make it appealing to people with a public health background who have to pivot their career now. But I still mostly focus on social workers up till up till recently, and I have to tell my clients, you if you're pivoting your career, which a lot of social workers are wanting to do right now because they're burnt out and low pay,
Yeah.
you cannot go up to someone and say, "Oh, I have a social work degree." They're not going to know what the hell that means. They're going to think that all you've done is steal children from families. That's what the belief is, and you have to sell your skills differently. The fact that you have that MSW is not going to mean anything to people in these other settings. You should still apply for those jobs, but you have to change the way that you are selling yourself, right? That's just the reality of the world. So
Mhm.
you're absolutely right about that. Um, and I work mainly with individuals, but I think that it's when it comes to the career coaching. So that's what I do, is help them find jobs, pivot their career and whatnot. Um, it's not the main thing I'm focusing on, but it is something that I still do. And I want to help, advocating for yourself, learning to sell and market your skills is what I help them with. But this is a systemic issue. I don't think that the social work profession itself advocates enough for the profession to change the perspective that outsiders have of social work. Does that make
Mhm.
sense?
It does.
The NASW should be out there educating these different industries on what it is, all the things that social workers can do, but they're not doing that. They're still stuck, in my opinion, they're still stuck in this therapist, medical social worker serving vulnerable children and adults mindset. And I just don't think that model is going to work very well moving forward.
I would agree with you. Because for one, it is limiting and there's misconceptions on what it means across the board, I feel like. And it's like needing to have a mediator in the room in other situations that is um, unbiased and, maybe not disconnected from the end result because we're all connected, as we've talked about in every area. It affects everything affects everybody. Um, but at the same time, there needs to be more of that social work type of situations in all facets. And what you're talking about, I feel like, is a revolutionary approach to how the country has been handling this topic over the years, over the generations, and um, having more conversations like this where it's made more available to people's ears and putting thought into people's minds about how problematic it is to not just not have the mindset of like everything is affecting everybody and it's going to affect you sooner rather than later on all levels. And certainly as it pertains to aging and the need for caregiving.
Yeah, absolutely. And we don't have time to unpack it here. Sometimes I do a podcast episode and it's just about my 4D framework. And you can see that on my
Mhm.
LinkedIn tagline. But all of this is how I developed the 4D framework, which is basically four dimensions. I think we live in a world that tries to apply one-dimensional solutions to four-dimensional problems.
Mhm.
Um, and I focus specific on healthcare. I think you can fill in the blank with whatever. And one day I would like to write up some material, create some materials for 4D social work because I think that it needs it. But that's exactly what all of this is getting to. So that's
Mhm.
another small plug for myself, this framework that I created. But that's the problem is that we're trying to apply one-dimensional flat solutions to problems that are four-dimensional, and
Mhm.
we really need to up our game.
Absolutely. Um, And yeah, the compartment of podcast conversation feels limiting for sure in all the just many things that you have to share and to offer. For those listening that are interested in everything that Jacob's talking about, it'll all be in the show notes to explore it deeper and to connect. Jacob, I know that the time is winding down, and I want to be respectful of your time. But I would love for you to share some comments about just your thoughts on what is going to happen in our society if there is an AI presence in caregiving universally, and what that's going to mean for a lack of compassion, a lack of indignities as we age.
Yeah, one of the common one of I don't know if this is a product of the fact that I just happen to have a lot of social workers and mental health providers in my network, or if this is truly representative. But I talk about AI, and obviously with the social work background, I talk about mental health, and there are a lot of therapists who are adamant that AI is not going to replace them, and I completely 100% disagree with that. I think anyone in any profession, therapy included, should be concerned about AI replacing them. Uh, there are many people who are in between, and they're like, I don't think it's going to replace all therapists. I agree with that. I think what's going to happen is that the small number of therapists who are still remaining 10, 15, 20, who knows the timeline years from now, um, those are going to be the more expensive ones. And it's going to be the wealthier individuals who are going to be able to afford that kind of care. Um, and then everyone else is going to be, using uh, less effective but free or much less expensive AI resources. I'll reference Noah Yuval Harari. He wrote *Sapiens* and then *Homo Deus* and then *Nexus*, where he talks about these very problems. And I agree with him more or less that the following is going to happen. Not just AI, but also biotech. There are people pouring millions of dollars into how literally to make us live in our biological bodies indefinitely. But what baffles me about the people who are working on these things, whether it's AI or biotech or the combination of them, is they usually Harari is an exception to this rule, but many of these people speak about them optimistically and they don't think about the social implications of it. Like, there's no way you think that if you believe that biotech is going to allow us to achieve mortality, and I agree that it is. If AI is going to allow us to like integrating with our consciousness or whatever, going to allow us to achieve mortality, immortality, which I believe that it will, there's no way that anyone in their right mind can say that every single person is going to have access to that technology. No, only the people at the top of the socioeconomic level are going to have access to that technology. And so what Harari predicts, and I more or less agree with him, is that we're going to get to a point where we essentially have, in effect, two different human species, the haves and the have-nots. I think that AI is going to make our socioeconomic gaps and our health disparities worse, not better. It seems like the opposite is true right now, but I think moving forward, it's not going to be that way. And so when it comes to caring, and caregiving and aging and whatnot, the place that I always want to go is what I just said, and not an optimistic, rosy outlook. I definitely think that these ethical issues are going to come up. I think it's going to be rough.
I feel like this sounds like a dystopian
Yeah,
fictional
I know.
society that I've read about many times over in a book series that maybe I've indulged in over the years.
Yeah,
And honestly, there's a lot of things that I've come across in, we'll call them stories, for lack of a better way to say that right now, that are way more than that. It's almost like the authors of those books are the ones who do have those crystal balls because so much of it seems to be unfolding.
very free.
Um,
Yeah, they were very prescient for sure.
yeah, like freakishly privy to just what was going to be happening in the future. Some of them, I don't know if you're familiar with a lot of those series or not, but wow, is that on
Some of
point
them,
with what's
yeah,
happening?
I
It's
know.
kind of
It's
crazy to
crazy.
think about that, but
Yep.
I don't think that it's far-fetched to believe that a lot of those things are what is forthcoming. And yeah, really terrifying to think of that. But I think having more conversations like this and nobody's going to stop AI. Nobody's going to stop the technological advances in those industries, we'll call them, I suppose. But having an awareness of holding tight on the human experience and reclaiming that, I feel like, where and when we can,
Yeah.
is really going to be important moving forward to just honestly hold on to like humanity because that's going to look a lot different in the future if what you are saying is going to be forthcoming in terms of those two different types of
Yeah.
humans, essentially. I mean, but again, it can sound crazy to somebody who maybe has been living in a cave or something and isn't aware of this type of information, but
Yeah.
I don't know. I feel like it's on the horizon.
Yeah, I would say to not just be totally pessimistic. A few things I can imagine someone can do is, first of all, what is a small way that you can learn to use AI in a healthy
Hmm.
way? I use the crap out of it to help me work on business related projects. I'm working on
Right.
a booklet right now, which I'll mention at the end when you ask me to tell people how they can reach me. Um, and try to find some kind of healthy relationship with it. Train it to solve some kind of problem for you. That's what AI training means, especially if
Hmm.
you're younger and you want to be economically relevant moving forward. You got to have some kind of skill like that. Um, there are people who are, I think, have really good intentions with using AI well. We can
Hmm.
certainly the window of possibility is there for us to learn how to use it well and interact with it in a healthy way. It's there. I'm not optimistic that that is going to be the reality that comes to pass, but there are some days where I have more hope than others. Identify those organizations and those individuals who seem to truly want to do better for humanity, and they're using AI. And if you're someone who gives to charity or gives money, like maybe there's things that you can do to focus more on those organizations rather than others. Um, I don't know the names of specific ones. I'd have to do the research myself. I've just heard about examples where I think, okay, they're doing better things with it. So that does exist. Focus more on those. Um, and yeah, I guess what I would just say, continue being as human as possible. Still like music and art and hanging out with family, and things like that. Get outside. Get outside. There's there are things where people can take a tour of the Egyptian pyramids and probably some Everest and things like that, the AI, and it seems real, but there's no way it can possibly have all the effects on our brains as actually being outside can do. So there are some things that AI is never going to be able to replicate. Embrace the hell out of those things while we can.
I love that message. Absolutely. And yeah, use AI to be productive in things like business, but just don't twist what its purpose is in a productive and healthy way. There's a lot of ways that can cross a line for sure. So just that awareness
Easily,
again.
easily.
Yeah, very easily and very disturbingly. And again, that's wow. I mean, I've been having AI conversations in different spaces on all the other ways that it's really having negative effects, especially on our youth. But in this conversation today, and this has been a very fast hour. I can't believe it. But as we're getting to the end of our window today, I'd love for you to just share with our listeners what you would like them to walk away thinking about today.
Yeah. Um, I mentioned the tension earlier with the uncomfortable place that social work is. I think I consider we all have those tension spots, right? Where both things are true at the same time. That's how it is with me and AI. And I just want people to know it is really uncomfortable for me. And I know a lot of other people to simultaneously say, I'd snap my fingers and get rid of it if I could, while also using it really, really heavily and encouraging people to learn to use it well. That is an uncomfortable spot. And there are many moments when I think, oh my gosh, when I tell people that I think that they should use it, or even me using it myself, am I doing something bad for the future of humanity or for the future of my own children? I don't know. I have those questions, right? So I would say something to walk away with is learn to work with navigating those uncomfortable tensions because they're not going to go away. Whether it's in healthcare, whether it's with the AI, whether it's with the social work profession, we live in a life, most of our lives are in the gray area. Now, our ideological system wants to try to say you're either red or blue, left or right, conservative, liberal, whatever, but we live in gray areas. And I would just encourage people to see that, it's a lot more colorful here in the middle. uh, and learn to be uncomfortable with it and embrace that tension as the beautiful thing that it can be, and to use it as a tool rather than as an enemy. Um, how to do that would take much more time than we have now, and I just want to let people know that we all live in those comfortable places. Don't ignore it, right? Yeah. Is that an okay answer to your question?
That was perfect. That was more than okay. And I think people are going to want more of your influence and words of wisdom in that. So tell us how we can find you outside of this space.
Yeah, if you're someone who wants to pivot to a different field, especially social work, public health, or ministry, then the versatile professional.com, or follow me on LinkedIn for sure. Jacob Evans, Kendall, Evans. And my other one is The Smart Patient. I'm currently working on a book. It should be published, booklet should be published in the next couple of weeks. I'm focusing right now on helping people who have had heart valve surgeries like me. Um, and I also speak on this. I help patients and caregivers with things that their doctors are never going to tell them, which, they're really, really simple things, but I've just learned them by stumbling through this myself. So that's thesmartpatient.com. And I post about both of those things and AI and all kinds of other things on my LinkedIn profile. So definitely follow me there.
That's amazing. Thank you for all this important work that you're doing and all the many ways that you're showing up and the interdisciplinary work in what you do. It's really intriguing for sure. It's really connective, and I'm just thankful for this conversation today. So thanks for being here.
Well, thanks for having conversations like this for other people to listen to your podcast and get a variety of perspectives. Thanks for the work you do.
Thank you. This one really left a lot to think about, and I hope you do. Think about it, that is. That was really the big takeaway message for me, is that thinking about and planning for and having conversations about our own mortality rather than avoiding it will help us not only prepare our loved ones who remain here after we leave, but to help address the real issues with aging far before they are upon us. The mistake that seems to be universal on so many topics is that it's not affecting me, so it's not my problem. It's not affecting me right now, so I don't have to worry about it. That couldn't be farther from the truth. Aging truly affects everyone in some way or another. A thought that keeps coming back to me from this conversation is the need to spend time with older generations. Those of us that had been fortunate enough to have grandparents in our lives understand this deeply. There are many benefits to having conversations with older generations for both the young and the old. It's how the word is passed, how traditions are continued, and how we learn to appreciate and learn from the past to make the best possible decisions for the future. Dr. Jacob Kendall practices an interdisciplinary lifestyle that understands the need for an intersection in a multitude of places in life. Connect with him and learn more about how he's showing up in the world with the links in the show notes. Until next time, friends.